Hello, welcome. Welcome to tonight's Facebook Live session hosted by the American Migraine Foundation and the Move Against Migraine Initiative. My name is Abigail Chua, and I will be leading tonight's discussion on nutraceuticals and food and their role in migraine and migraine treatment. So while we are giving people a chance to log in, I will give you a little bit of background on myself. Again, my name is Dr. Abigail Chua. I did my medical training at Philadelphia College of Osteopathic Medicine. I did my neurology training at Temple University Hospital and my headache medicine fellowship at the Jefferson Headache Clinic, also in Philadelphia. I first became interested in headache, I think, during my neurology residency, where I saw many patients suffering from headache and migraine. I think what I really enjoy about headache medicine in general is that not only is it a really rapidly growing field, we're learning more and more every day, more in terms of treatment. It's really the impact on patients that we can have that I think is so special about this field. I remember one of my first patients in residency, she came in to me for the first time, really suffering from chronic migraine. Someone in the past had put her on a medication that was causing a lot of side effects. She was gaining a lot of weight, losing her hair, and her migraines really weren't under control. So after speaking with her, we kind of changed her medication regimen around. I saw her for follow-up a couple months later, and she was just ecstatic. She was losing weight, her quality of life was just so much better, and her headaches were under control. The first thing she did when she saw me was just give me a huge hug to thank me for what I had done, and really all we did was change one medication. So I really love what I'm doing. I feel really lucky to be in this field, and I feel lucky that we can help patients like you and help change your life. So thank you for allowing me and people like me to be a part of your care. So let me just see how many people we have here. Kind of bear with me, this is my first time doing anything with Facebook Live, so I'm trying to catch up and see who is on and if there are any questions right now. I see a lot of people are joining, so for those of you that just joined, again, my name is Dr. Abigail Chua. I am currently a neurologist and headache specialist at the Hartford HealthCare Headache Center in Connecticut, where we see a wide range of patients with migraine, different headache disorders, as well as facial pain. Okay, so I think just scrolling through, no live questions yet, but there were some questions posted earlier when the event first posted, so let's take a look at some of those. Okay, so the first question here is from Sarah J. McKinstry, and she asks, is it worth trying to go dairy or gluten-free? I think worth it is probably very subjective to each person. I think it also depends on where you are in terms of your migraines. So if you are very new to having migraines and haven't really tried a lot of medications yet and still trying to see what's causing your headaches, of course in conjunction with talking to a headache specialist, then maybe yes, doing some kind of diet, trigger elimination, seeing if there are things that could be contributing to your headaches is worthwhile. In terms of specifically dairy or gluten-free, the science and evidence behind specific food triggers is not so robust right now. Some studies show that there could be a correlation or there are food triggers, and some say there aren't. So gluten specifically is kind of a hot topic right now. A lot of people are going gluten-free just for general health reasons that not necessarily have to do with migraine. I think when you're talking about gluten itself, you kind of have to think about, what are you really looking at? Are you talking about celiac disease where there is an actual immune response caused by gluten, or is it more of a non-celiac gluten sensitivity? So those two things are very, very different. you don't need to have autoantibodies to gluten to, be sensitive to gluten. But again, I think that would be something that you would talk about with your doctor, looking at your diet, seeing if there are issues when you do eat gluten. Are they causing anything? General signs of having a gluten sensitivity would be like bloating, gas, abdominal pain, abdominal distension. And then when speaking to your doctor, you can kind of go and see what further workup you need to kind of see, do you have celiacs or do you just have a gluten sensitivity? Okay, let me see if there are any questions that I may be missing. Okay, I don't think so. So we will move on to the next question. This is by Jill Oglesby Dellin, and she asks, many people have encouraged me to get IgG and IgA testing for food insensitivity. My allergist says this is bunk. Can you help us understand this? Sure. So same thing, kind of what I just alluded to a little bit earlier about food allergies, food insensitivity, is that there's really no hard evidence for it right now. However, there are a lot of anecdotal reports from patients saying that, when they eat a certain food, it definitely triggers their headaches. So when we're talking about specifically looking at IgG and IgA, we're talking about things like celiac disease, seeing if you actually have an allergy or an autoimmune response to food, or you just have sensitivity. So there have been studies looking at diet elimination based on IgG testing. The three that come to mind, I've looked at testing patients based on about 260 known allergens. They tested their levels for IgG depending on those foods and then put them on an elimination diet to see if it caused any change in their headaches. In the one study, it did show a significant improvement after 12 weeks being on the elimination diet with the IgG sensitive positive food. The other study also looked at patients who had IgG sensitivity. That study did not show any significant decrease in their migraines when they were put on that elimination diet at 12 weeks. However, at 4 weeks, it did show a slightly decreased amount of migraines in that first 4 weeks. The third study that I'm recalling is looking at patients who had I think it was irritable bowel syndrome, and then putting them on with headache, and then putting them on an IgG elimination diet. And those patients did seem to improve when they were on the elimination diet based on their IgG testing. So, what does it really come down to? Should you get tested for it? Some studies say yes. It really depends on talking to your headache specialist about what's going on with your specific type of headache. If you're responding to treatments but yet you're finding that you're still having frequent migraines and you really want to know what's causing it, or you really think there is something that's you're eating that is triggering it, then maybe that's something worth exploring. Okay, so I don't think I've missed any questions yet. So let's go to the next one. This is from Dr. Brooke Pellegrino. She is one of my colleagues at the Hartford HealthCare Headache Center. So she is asking, can you please talk about the changing view with regard to butterbur? Sure. And this is actually a really hot topic right now. So for those of you who aren't so aware with butterbur, we'll go a little bit of background on that. So butterbur is a shrub in, I think, the chrysanthemum family, if I'm not mistaken, that was, I think, used to wrap butter in the heat. So I think that's where part of the name comes from. Its formal name is Petasites hybridus. And it's actually interesting because based on the trials on butterbur, the American Headache Society did and the AAN, American Academy of Neurology, gave it level A evidence, meaning that it had evidence for prevention of migraine, and it was actually the only vitamin/supplement to get that rating. However, and that was around 2012, they put out that guideline. However, since then, that paper has since been retracted because of the concerns about butterbur and its effect on the liver. So the butterbur plant has a potentially carcinogenic and hepatotoxic alkaloid in it. So when you manufacture butterbur, you have to be careful to remove those potentially harmful alkaloids, otherwise you risk damaging your liver. So there was one company based out of Germany that actually was shown to, I guess, have low levels of it or no levels of the harmful alkaloid. They started making the product, I think, in 1988, and then somewhere along the line they changed their manufacturing process. So because of that, it's actually not so clear if it was because of the change in the manufacturer or the change in the product itself, but they lost their license to sell that product in Germany anymore. So that was kind of concerning to everyone looking at that, saying, you know, what's going on? Is it safe or is it not? Other studies looking at commercially available butterbur, specifically looking at 21 different types found in the U.S., found that out of 7 of those 21 did contain those harmful alkaloids that I mentioned. So I think if you look at the World Health Organization kind of there's a group called Vigib Base, I think it is, looking at different products and seeing all the things that have been reported in terms of side effects. Butterbur had, I think, 40 cases of liver damage, hepatotoxicity, and 2 cases of significant enough liver damage that the patients needed liver transplants. So right now, for the most part, I don't really think many headache specialists are providing or recommending butterbur. You know, it has been shown to be effective in some trials, but given the risk factors and the potential damage to your liver, cost versus benefits, probably not worth it. If somebody is on it already, you know, they need to tell their headache specialist so they can be monitored in terms of their liver function test to make sure that they're not having any abnormalities. There are a lot of over-the-counter supplements, you know, easily found on Amazon, things like that, that have a combination of different supplements and vitamins, and some of those do contain butterbur in it. I'm not saying that all butterbur is dangerous. What I'm saying is that because supplements and herbs are not as regulated the same as pharmaceuticals in the United States, it's hard to say what products really contain the degree of the active ingredient that we're looking for and what are or are not harmful. So I think, again, with the butterbur, there's just so many other options. It's not worth giving somebody something that could potentially damage their liver. Okay, just let me see. If I'm missing questions because I'm not scrolling through this properly, somebody just let me know. I don't think I'm missing anything right now. Let me see. Okay, no? All right. So the next question here is from Teresa Texley. And she says, I've been on Topamax for 10 years now. My migraines have just recently increased. I had always had wonderful success with this med. I have added the herb ginger. Any thoughts would be appreciated. Thanks. Okay, so first of all, whenever headaches change, you always want to just make sure that it's nothing else is causing that change in terms of like an illness. So if there's something different about your migraines, definitely bring it up to your doctor if it's concerning, especially if you have neurologic symptoms that you didn't have before, things in your vision, numbness, weakness anywhere, things like that. That's definitely something you want to share with your doctor. In terms of the herb ginger, it has been shown to be effective in migraine, but the studies I've seen really talk more about acute treatment and not so much preventive. So there are a couple studies that come to mind. The first is comparing ginger capsules to sumatriptan, 50 milligrams, I believe. And that study did show that they were pretty much comparable in terms of efficacy in aborting a migraine within 2 hours, and the patients who were on the ginger had less side effects compared to the patients who were taking the Imitrex. The other study, I think, was done looking at a commercially available sublingual treatment for migraine combining feverfew and ginger. And I think based on that study, it did show that it could be effective. However, feverfew itself has really, in some trials, has shown to be effective in migraine again, but the consensus is that it's not really used so often. So for Canada's guidelines for feverfew, they say that it's likely to be not effective, and for the American Academy of Neurology's guidelines, I think it's level C of possibly effective, just because there really isn't that much data on it. Feverfew also can interact with a lot of blood thinning medications, so if you are on aspirin every day, Coumadin, things like that, you might not want to take feverfew products. Also, going back to ginger a little bit, I think ginger could be really great as an addition to other medications for headache. I really use it more, again, in terms of an acute thing. It's great for nausea that comes along with migraine, so I have recommended ginger chews for a lot of my patients. Sometimes the medications that are used for anti-nausea can cause a lot of tachycardia or fast heartbeat, and a lot of patients don't like that, or they're just not really interested in taking a medication if they can take a supplement or something like that for the nausea to help. So ginger chews can be really great. Personally, I like Chime's ginger chews just because I think they taste good. However, you have to be careful about which kind of ginger chews you pick, because they do have sugar in it, so that's something to be wary of. The Gingins is another popular brand for ginger chews, and so is Prince of Peace. You can also use fresh ginger, which I think is great. Not so convenient because they're not individually wrapped, and you can't just put them in your pocket. But taking like a quarter size of ginger could be helpful in either aborting the headache or helping you with the nausea. Good quality ginger ale could also be an option, as long as it actually contains ginger in it and not just sugar. Okay. Next question is from Cynthia A. Mitchell, and she asks, is it better to go wheat-free or gluten-free for migraines? I guess that really depends on whether or not you have a gluten sensitivity or you have celiac disease, like I mentioned earlier. So all wheat products contain gluten, but not all gluten is from wheat. So you can also find gluten in rye and in barley. So if your goal is to see if you have a gluten allergy, then, or insensitivity to it, then I would say try to go eliminate things that have wheat, rye, and barley. If you're finding that you have a specific aversion to wheat products itself, which has been reported in the literature, then go for the wheat. It's hard to really say. Again, there's no hard, fast evidence that there are food triggers are 100%. So it's really going to be very patient dependent, and to kind of see how you feel when you have these products. Another thing, just quickly talking about food elimination and diets, such as eliminating things that you think are causing your headaches. There's different ways to go about elimination diets. So the first one is when you notice you have a trigger. So you eat something and then 10 minutes later, an hour later, you have a horrible migraine. When you do that, when you're noticing these things, and it's very easy to do an elimination diet, just get rid of that certain food or drink. Another way to do it is using the IgG testing to see what you're specifically allergic to, and then going based on that. And then the other is using a food diary. Food diaries can be great, however, they're also very time consuming, and patients really need to be diligent and motivated to keep track of what they're eating. Apps that are available on your smartphone can help with that, because there are some apps that can actually predict which foods are more likely causing your migraines or triggering your migraines than others. So it's a little bit easier. Keeping it on a piece of paper, may not be so exact. The other thing about that is there's a question of, when does a food become a trigger? Because not every food, even if it is a trigger for you, may trigger a migraine every time you have it. So, is it 25% of the time it's causing headaches, so it's your trigger? 50? What is that number? I think generally people are, saying that if it's causing a migraine 50% of the time, that it's may be a migraine trigger for you. Okay, let's see. Sorry, I'm just looking for the comments here. Just give me 1 second. Oh, so I'm not refreshing and I'm missing lots and lots of comments, so I'm so sorry. Give me 1 second. Okay. So Aaron Weber is asking, what supplements are prophylactic besides B1 and B2? So the most studied supplements for migraine prophylaxis would be B2, which is the riboflavin, magnesium, CoQ10, feverfew, and butterbur. So I spoke a little bit about the feverfew and the butterbur already. Those are probably least used at this time. When we're talking about supplements, the question is, how is it working on a migraine? So there we divide the three left, the riboflavin, the CoQ10, and the magnesium, in terms of how they interact physiologically. So the thinking is that riboflavin and CoQ10 are affecting the cells in our body that produce energy, namely the mitochondria. So they either help support energy metabolism, or they help stabilize the mitochondria so that it can function properly. It's interesting, actually. There was one study that showed there was mitochondrial dysfunction in migraine patients in their occipital area. So it stands to reason that riboflavin and CoQ10 makes sense as a migraine prevention. They're both generally well tolerated. Riboflavin is, again, B2, so it's a vitamin. That flavin in its name means yellow. So the most common side effect of riboflavin is having yellow or orange tinged urine, which is completely safe. It has nothing to do with your kidneys. It's from the vitamin itself. Otherwise, there really are no big side effects to riboflavin. The recommended dose is 400 milligrams a day. That can either be taken 400 milligrams at once or 200 milligrams twice a day. That twice a day dosing can be inconvenient for some patients. I know it's hard to remember that second dose sometimes, so some people do take the 400 altogether in the morning. In terms of CoQ10, so again, helping stabilize and support mitochondria, which make energy. The studies on that were looking at doses of 100 milligrams 3 times a day, and it has been shown to be effective in some studies. I think, however, CoQ10 has level C evidence from the American Academy of Neurology, and riboflavin has level B. CoQ10 is probably one of the more well-tolerated supplements, I think. It can cause some gastric, irritation, but really just like a mild unsettling in your stomach, and I think that really does not happen to a lot of people. Sometimes it can cause some burping, I think, but really no side effects. Now for magnesium, I think that's probably one of the more studied prophylaxis in terms of supplements for migraine. Magnesium, comes in lots and lots of different forms. So the element itself stays the same, but what it's mixed in can sometimes make a difference for some patients. So when we recommend magnesium in our clinic, we're generally recommending mag oxide. Magnesium oxide is well tolerated. However, all magnesium kind of has the same side effects, which we'll go over in a little bit. But the bioavailability of magnesium oxide is not the best compared to others. However, because it's a very small element, and in terms of what it's mixed with, you can actually get a little bit more bang for your buck, let's say. So even though it's less bioavailable, you get more of it, so maybe you're absorbing the same amount as another form of magnesium. Mag citrate is another type of magnesium that you can use for migraine prevention. The doses of that, I think, are 600 compared to 400 for the mag oxide. Mag citrate has better bioavailability than mag oxide. And then there's also other types. I think magnesium L-threonate is actually one of the hot new magnesium forms out there right now. It's being studied looking at prevention of dementia and used in Alzheimer's disease. The studies and the thinking there is that formulation of magnesium is actually able to cross the blood-brain barrier, so really affecting the brain directly and the central nervous system directly. So, but in terms of looking at that specifically for migraine, I don't know if that's been done yet. Let's see. So just quickly, I mentioned like the main supplements used for migraine prophylaxis. There are others, but not so well studied. I can't speak about it really in depth, to be honest, because there's not a lot of information on it, but there are some reports of lavender, not just lavender oil, but actually ingesting lavender, ginkgo biloba, all these things. I would say that if you are interested in a supplement, which is completely fine and may be appropriate for you, just talk to your headache specialist first, because everyone thinks, not everyone, but there's some thinking that because it's natural, it's safe, and as I mentioned with the butter, that's not necessarily always true. Some of these supplements can interact with other medications, feverfew, for example, interacting with anticoagulants. Riboflavin, and I'm not so sure how accurate this is, but I came upon this in my reading, was somewhat contraindicated in patients with cataracts. So, things to just kind of think about. All right, let's see, another question. Oops. Oh, and I think we are almost running out of time. I did not realize it was 7:29. One more question, I think. So, Brennan Hagee is asking, do vitamins expire, and is there any contraindication to taking them when they're expired? So actually, that's a good question. So the date that's listed on the bottle of supplements is not actually an expiration date. What it is that is the date that product is going to be at its most potent. So after that, it tends to degrade over time and becomes potentially less effective. So that not necessarily expiring in terms of the way we think about food like milk or cheese, but it's potentially not as effective. I think in general, most supplements have a shelf life of not the date, but safely used 4 years, but general safety and just guidelines would say no more than 2 years. However, things like fish oil, cod liver oil, those kind of things definitely do expire, so just adhere to whatever date is on that bottle. Let's see. Okay, so I think that's it, all the time we actually have for today. I want to thank the American Migraine Foundation for inviting me to give this talk. I really enjoyed giving it. I hope it was helpful for you. I do have a lot of resources in terms of review articles and things like that, so if anyone is interested in me sharing those things, just post it and I can link it onto the Move Against Migraine Facebook page. So I think it's time to say goodnight. So I will say goodnight. Thank you so much for joining me, and take care. Bye.